Hello, I'm really excited to start a class on pharmacology, veterinary pharmacology. And in our today's talk, we will be discussing the general pharmacology, the unit 1, and the specific topic for today is dosages and routes of drug administration. Right? I'm Professor Govind Narayan Purohit, the former Dean Postgraduate Studies, Rajasthan University of Veterinary and Animal Sciences, Bikaner, and I have been I have been providing you video lectures on all the topics on veterinary gynecology. And now I am excited to start a new YouTube channel, the GNP Sir Classes Official, where we'll be providing the students the lectures on all subjects, starting from anatomy to gynecology. So I hope you will like these videos and they will be helpful for your composite exams and they will also be useful for your GRF preparation in veterinary science. Right? We will also be providing many MCQs. So let us start today's talk, the dosage and routes of drug administration. So here are the contents on which we are going to provide the lecture today. The factors governing the choice of route of drug administration, the oral administration, parenteral administration, inhalation, and topical or specialized drug delivery systems and the fixed dose combinations. Right. So first, let us try to understand what is dosage and routes of drug administration. So first, let us understand what is a dose. A dose means a specified amount of medication taken at a specific time. So, according to the American Medical Association, drug doses are expressed in metric mass units, for example, milligrams or milligrams per kg body weight. And dosage is the amount, number, and frequency of doses over a specified time. So, if you are prescribed a paracetamol 500 milligram, so that is the dose. And if you are advised to take it 3 times a day, then that is the dosage, right? So that makes the difference between dose and the dosage clear, right? Now, what will decide the route of drug administration? There are a number of factors which will govern, which will regulate the choice of the route of drug administration, the physical chemical properties of the drug, the site of desired action, whether it is localized or generalized, the rate and extent of absorption of the drug from different routes, the effect of digestive juices, ruminal microflora, and first pass metabolism on the drug, and the rapidity with which the response is desired, whether you desire a quick response or whether you desired a slower response or whether you desire a sustained response. Then the intensity of action desired, the type of response desired, and the accuracy of the dosage desired, and the condition of the patient. If the condition of the patient is serious, you will always require intravenous administration. Right? So here are the routes of drug administration. The systemic routes, which include the oral, parenteral, inhalation, and the local route, which includes the topical application of the drug. Now, oral and enteral administration, what also known as the enteral administration. The advantages are it is safe and convenient. Drug preparation need not be sterile. Both liquid and solid dosage forms can be given orally, and it is the most suitable route for gastrointestinal tract infection and gastrointestinal parasites. A large volume of liquid drug preparation can be administered. These are the advantages. And what are the disadvantages? We will discuss later. First, I want to stress upon that giving oral medicine to ruminants never grasp the tongue because that can cause aspiratory pneumonia. And for horses, a stomach tube is required for administration of oral medicines, right? So these are the disadvantages. Slower onset of action, drug absorption is irregular and unpredictable. It is not suitable for uncooperative, unconscious patients. It is not very useful in ruminant species because of the presence of large amount of ingesta in the rumen, which decreases the absorption of the drugs. And then strong electrolytes and highly polar drugs are not absorbed by the oral route. Poor administration technique may cause aspiratory pneumonia, what is also known as the bronchopneumonia. It is not suitable for drugs that undergo extensive intestinal or hepatic first pass effect. Then chances of superinfection oral therapy with antimicrobial suppresses the beneficial effects of ruminal and intestinal microflora. Okay. So these are the disadvantages. Then we come to the parenteral route. That is the first is the intravenous. Uh, for advantages, that quick onset of action, useful in emergencies, provides 100% bioavailability. Highly irritating and non-isotonic solution can be given by slow intravenous injections. Large volumes of fluids can be administered. Say if you want to go for fluid replacement, animal is dehydrated, you want to administer 10 liters, 20 liters, then you can administer by intravenous route. Useful when precise control of the drug is required, and drugs that are rapidly metabolized can be infused slowly over time. So these are the disadvantages. It requires special skill. Extravasation of the irritant drugs may cause phlebitis and necrosis of the adjoining tissues, and it is one of the least safe methods because vital tissues like heart, brain, kidneys get exposed to high concentrations of drugs, and overdosage can cause immediate toxicity. The injection must be perfectly sterile, pure, and soluble. It is not suitable for insoluble drugs or oils or drugs in suspension. The intravenous drug should be clear solution. Then there is the intramuscular route, most commonly used, and it can be used for solutions, aqueous and oily suspension, and other depot preparations. Absorption is fairly rapid except for oily and depot preparations. Mild to moderate irritant preparations can be injected but are not generally advised. The duration of action is longer than that of intravenous but usually shorter than that of subcutaneous. It is more suitable route for factitious, wild and zoo animals, and in fact it is one of the most commonly used route of administration in veterinary therapy. The disadvantages are that large volumes cannot be given, and improper deposition in the nerves, blood vessels, fat, or connective tissue can cause tissue damage. The sites, now we talk of the sites of for injection. For intravenous, for horse, cattle, goat, sheep, jugular vein, even for camel, jugular vein is the site for administration. And cephalic vein and recurrent tarsal vein for dog, and ear vein for pigs. Then the sites for intramuscular injection, cattle, sheep and goat, hind limb, gluteal region covered by gluteal muscles, and the posterior aspect of thigh between the semimembranous, membranosus and semitendinous in sheep and goat, right? That is the preferred site. For horses, neck region and the biscuit region, but the neck region is one of the most preferred site for intramuscular injection in horses, and in for dogs, the hind limb between the semimembranosus and semitendinosus muscle. Because then there is the subcutaneous route. The advantage is large volume can be administered. Absorption is rapid but slower than that from the intramuscular side, suitable for palate implantation and depot preparation. The rate of absorption can be manipulated by the application of heat or cold. Disadvantage is it is not suitable for irritant drugs, not suitable in shock states because reduced peripheral circulation may decrease the absorption rate. When there is the intraperitoneal route, the advantage is it provides fairly rapid distribution of the drugs and large volumes may be administered. It is suitable for small size animals like rodents. The disadvantage is it is not suitable for irritant compounds as they may induce chemical peritonitis. Right? Then we have other routes of parenteral injections, that is the intrathecal route, drug deposited in the subarachnoid space, epidural route, this is the most commonly used route for epidural anesthesia. The drug is deposited through a vertebral interspace into the epidural space. The preferred site of injection is between the first and second coccygeal vertebrae in horse and cattle. And the anesthesia is deposited for anesthetic effects on the hind limbs and even the back. The other routes include intra-arterial, intracardiac, intrathecal, intramedullary, intradermal, intraarticular, intraruminal, intrathoracic. Then there is the inhalation or the pulmonary route. The advantage is that alveoli offer vast surfaces of drug absorption and facilitate the rapid onset of systemic effects for volatile liquids and gases. Then the second advantage is controlled administration is possible for moment to moment adjustment. It avoids drug loss through hepatic and intestinal first pass effect. It is suitable for respiratory disease. The disadvantages of inhalation is requires special technique, device, and skill to operate. It is not suitable for irritant substances. Inhalation is also used for anesthesia in different animal species. Then the topical or the skin application or the local application, absorption of drugs through the skin is proportional to their lipid solubility. Absorption can be enhanced by using occlusive dressing, injunctions, or special drug delivery devices like ear tags, transdermal patches. Then the dips are commonly used in sheet in which the whole body is immersed for a time in medicated fluid, particularly insecticidal fluid. Then there is the inunction, application of semi-solid to liquid drug preparation on the surface with smearing or rubbing. And then there is the dusting using powders, particles of solid matter on the surface. When using the topical application, one must be careful that the animal does not lick if the substance applied is toxic when consumed orally. Then the mucous membrane, sublingual and buccal route for highly lipid soluble and non-irritating drugs. Transrectal, intraocular, intranasal, intramammary, commonly used for therapy of mastitis in dairy cows. Then intrauterine, commonly used for uterine infections in cattle and other species. Intravaginal and oral into the ear. Then specialized drug delivery systems include the transdermal delivery system. They are adhesive patches that deliver the contained drugs at a predetermined and controlled rate into the systemic circulation via stratum corneum. It bypasses the first pass effect, useful for drugs with very short half-life or narrow therapeutic indices. You can see here in the picture, this is a transdermal patch. Then liposomes, lipid bodies, minute lipid bilayers enclosing an aqueous compartment, water-soluble drugs enclosed in an aqueous compartment, lipophilic drugs in the lipid phase, liposomal carrier systems deliver the drug across the cell membranes. Then there are specialized drug delivery systems like the dermojet, as you can see in this picture here, or hypospray, special form of subcutaneous administration without needle. High velocity jet of drug solution projected from a microfine orifice using a gun-like device. Right? Then fixed dose combination preparations, combination products of two or more active drugs, they are valuable when developed based on sound pharmacokinetic and pharmacodynamic criteria. The advantages are it is more convenient to administer, increased therapeutic efficacy by the synergistic action of two simultaneous drugs, reduces chance of development drug resistance, reduces chances of adverse effects. But the disadvantages are that it is not useful when an animal requires the action of only one drug. It is not successful when different medicines in the preparation have variable pharmacokinetics. Does not allow alteration in the dose of one drug without detecting the dose of the another drug. Adverse reaction to preparation cannot be ascribed to a particular drug. Then there are increased toxicity chances. So these are the disadvantages. So these are some of the books you can refer for your reading, and I hope they will be useful. You can even refer the ICR website where you can get very useful, concise reading material for pharmacology. For the today's lecture, you will get this lecture PDF in the GNP Sir Classes app. So kindly download the GNP Sir Classes app and get this reading material for free. You, kindly, if you like this video, kindly give your comments, give your suggestions, uh, give your shares, and subscribe to the GNP Sir Classes official YouTube channel for all your needs from anatomy gynecology. We will be uploading lectures in this YouTube channel for your benefit. Students can benefit by they can prepare for the composite exam watching our videos. Even they can prepare very well for the GRF exam in veterinary science. And we will also be hosting many MCQ videos in this platform itself. So kindly share with your friends, your juniors, your colleagues to kindly come and join, come and watch, subscribe to the GNP Sir Classes official YouTube channel. Thank you very much for a patient hearing. See you. If you wish, I bring more videos for you. Kindly give your likes and subscribe. See you in the next video. Bye bye.